Something is happening in your body long before a heart crisis starts, and many people brush it off as age, stress, or a bad night of sleep. Your heart usually whispers before it screams, and if you miss those whispers, the price can be huge. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day, and the next video could help you catch a problem early. Here's the thing. Heart trouble rarely starts with a dramatic movie scene. It often starts with small changes in your breathing, your energy, your legs, or the way your chest feels during simple tasks. Across years of heart research, one pattern keeps showing up. The people who act early usually do better. And in this video, I'm going to show you 5 warning signs you should never ignore. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think heart trouble always feels like crushing chest pain that drops you to the floor. Not always. Sometimes it feels like being more tired than usual. Sometimes it feels like getting winded while making the bed. Sometimes it feels like swollen ankles after a normal day, and that misunderstanding is dangerous. A 2023 study from Monash University looked at 101,936 adults and found that the share of people who could not name even one heart attack symptom rose from 4% to 20%. Awareness of chest pain as a symptom also dropped from 80% to 57%. Think about that for a second. The warning signs did not disappear. People just stopped recognizing them. A 2023 survey from the Ohio State University Wexner Medical Center found that about 1 in 3 adults were not confident they would know if they were having a heart attack. That matters because heart problems are all about time. The longer you wait, the more heart muscle can be damaged. So no, the right move is not to tough it out. The right move is to notice patterns early and act fast. Number 5, pressure in your chest, jaw, back, or arm. Most people think heart pain has to be sharp and severe, but actually heart pain is often pressure, heaviness, tightness, or squeezing. Doctors call this angina, which means chest pain caused by poor blood flow to the heart. It can feel like someone parked a heavy bag of groceries right in the middle of your chest. And here's the part many people miss. The pain does not always stay in the chest. It can travel to your jaw, neck, shoulder, upper back, or arm. Why? Because nerves are messy. Your body sometimes sends the alarm through a side street instead of the main road. It is like a smoke detector going off in the hallway, even though the fire started in the kitchen. A 2018 study from Yale School of Public Health found that 53% of women said their provider did not think their symptoms were heart-related, compared with 35% of men. The same research showed that women were more likely to have extra symptoms like shortness of breath, indigestion, palpitations, or pain in the jaw, neck, and arms. So if your discomfort feels unusual, do not wait for it to become dramatic. Not stabbing, but squeezing. Not always crushing, but still serious. What should you do? Stop what you are doing. Sit down. Look at the clock. Notice where the feeling is and whether it spreads. If it lasts more than a few minutes, comes back, or shows up with sweating, nausea, dizziness, or shortness of breath, call emergency services right away. Do not drive yourself if the pain is strong. Do not tell yourself it is just gas if your body is clearly waving a red flag. Why gamble with your heart? And no food can fix chest pain in the moment. Let me be clear about that. But your daily meals can lower the strain on your heart over time. A simple start is replacing processed meat with 3 ounces of cooked salmon twice a week. The American Heart Association also says a medium banana has about 450 milligrams of potassium, and foods labeled low sodium have 140 milligrams of sodium or less per serving. Those are small choices, but small choices add up. But wait until you see number 4. Quick question. Have you ever felt chest pressure, tightness, or pain that made you stop what you were doing? Comment yes or no below. Number 4, shortness of breath during simple things. Most people think getting winded is just getting older, but actually, shortness of breath can mean your heart is struggling to keep up. Doctors call this dyspnea, which simply means trouble breathing. If your heart cannot move blood well, fluid can back up into the lungs. That turns easy breathing into hard work. Picture your lungs like dry kitchen sponges. They work best when air moves in and out freely, but when fluid builds up, it is like trying to breathe through a wet sponge. That is why some people feel breathless when walking across a room, climbing a few stairs, or lying flat in bed. The American Heart Association says heart-related shortness of breath can happen with activity, at rest, or even at night when you are lying down. Harvard also warns not to dismiss it as being out of shape if it happens with small amounts of effort. So ask yourself this: are you breathing harder during tasks that were easy a month ago? A 2024 study led by Duke University found heart failure death rates rose from about 82 per 100,000 people in 2012 to 106 per 100,000 by 2021. The study also noted common symptoms such as fatigue, shortness of breath, and swelling. That does not mean every episode of breathlessness is heart failure. It means you should stop brushing it off when the pattern is new, repeated, or getting worse. Here is what to do. Pay attention to when it happens. Does it show up while getting dressed, walking to the mailbox, climbing just 5 or 6 stairs? Do you suddenly need 2 or 3 pillows to sleep? Write that down. If breathlessness is new or worsening, contact your doctor soon. If it hits suddenly, is severe, or comes with chest discomfort, call emergency services. Now let's talk food in a practical way. More than 70% of the sodium people eat comes from packaged or restaurant foods, not the salt shaker. The American Heart Association recommends no more than 2,300 milligrams of sodium a day, with an ideal goal of 1,500 milligrams for most adults. A smart dinner swap is 3 ounces of fish with vegetables instead of deli meat or canned soup. A medium sweet potato has more than 500 milligrams of potassium, which can help support healthy blood pressure. But wait until you see number 3. Number 3, swollen feet, ankles, or legs. Most people think swelling is just from standing too long. But actually, swelling can be a sign that your heart is not moving fluid well. Doctors call this edema, which means swelling caused by fluid buildup. When the heart pumps with less force, blood and fluid can back up in the veins, especially in the lower body. Think of your circulation like a return line on a busy highway. If traffic slows near the city center, cars pile up farther back. That is what happens in your legs. Fluid has nowhere to go, so it leaks into the tissues. Your socks leave deep marks, your shoes feel tighter, your ankles look puffy by evening. Harvard says heart-related swelling often leaves an indentation when you press your finger into the skin. The American Heart Association says swelling can show up in the feet, ankles, legs, fingers, or even the stomach, and rapid weight gain can come with it. So if your body seems to be holding water for no clear reason, pay attention. A 2018 study from Case Western Reserve University found that 44% of heart failure patients had a mismatch between actual fluid buildup and what they thought they were feeling. In plain English, almost half were not reading their own warning signs correctly. That should get your attention. Your eyes and your scale can catch changes before a crisis does. So what do? First, check your shoes, socks, and ankles every evening. Press your thumb gently into the swollen area for 5 seconds. If a dent stays, make note of it. Second, weigh yourself every morning after using the bathroom and before breakfast. The American Heart Association warns that gaining more than 2 to 3 pounds in 24 hours or 5 pounds in a week can be a sign of fluid buildup. Third, call your doctor if swelling is new, worsening, or showing up with shortness of breath. This is also where label reading becomes powerful. Choose foods marked low sodium, which means 140 milligrams or less per serving. Aim to move away from salty frozen meals, canned soups, chips, and deli meat. Better choices are a baked sweet potato with more than 500 milligrams of potassium, a medium banana with about 450 milligrams, and simple meals built around fresh foods instead of boxed foods. Not fancy, but effective. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, unusual fatigue or sudden weakness. Most people think fatigue means they are busy, stressed, or just aging, but actually, unusual fatigue can be one of the earliest heart warnings. I am not talking about normal tiredness after yard work. I mean the kind of tired that feels strange, heavy, and out of proportion to what you did. Why does this happen? Because when the heart cannot pump enough blood, the body starts rationing energy. It sends more blood to the brain and heart, and less to muscles and other tissues. It is like your home losing power and the system shutting off extra rooms to keep the refrigerator running. The American Heart Association says fatigue from heart trouble can make daily activities like shopping, climbing stairs, carrying groceries, or walking feel much harder. Medline Plus also says severe tiredness and sudden weakness can be warning signs, especially in women before or during a heart attack. So if your body feels unusually drained for days, that is information. Do not ignore it. A 2023 survey from The Ohio State University found that about 1 in 3 adults were not confident they would know if they were having a heart attack, even though symptoms can include unexplained weakness or fatigue. That is exactly why this sign gets missed. It does not feel dramatic. It feels easy to explain away. What should you do? Compare yourself to yourself, not to other people. Could you carry groceries 2 weeks ago but now need to sit down halfway through? Are you too tired to finish simple chores? Does fatigue show up with breathlessness, sweating, dizziness, or pressure in the chest? Track those patterns for 3 to 5 days. If the change is sudden or severe, seek medical help sooner, not later. Why wait for a louder warning? Now for food, keep it simple. Eat regular meals instead of skipping and then overeating late. Build plates around steady, low-salt foods that do not force your heart to work harder. Try 3 ounces of cooked fish twice a week. Add a medium banana with about 450 milligrams of potassium or a medium sweet potato with more than 500 milligrams. These are not magic foods. They are just easier, smarter choices. I'd love to hear your story. What made you click on this video today? Share in the comments. Number 1, a fluttering, pounding, racing, or skipping heartbeat. Most people think palpitations are just nerves. Sometimes they are, but sometimes they are not. Palpitations means you can feel your heartbeat pounding, fluttering, racing, or beating unevenly. When that rhythm is abnormal, doctors call it an arrhythmia, which means the heart's electrical timing is off. Your heart has its own wiring system. When that wiring gets jumpy, the beat can feel like a fish flopping in your chest or like a drum missing a beat. A few harmless flutters can happen with caffeine, stress, poor sleep, or dehydration. But if it happens often, lasts longer, or comes with dizziness, shortness of breath, chest discomfort, or fainting, do not shrug it off. A 2024 Northwestern medicine study of more than 20,000 people with pacemakers or defibrillators found that people with atrial fibrillation, a fast, irregular rhythm, had a 29% higher risk of death than those without it. People with persistent atrial fibrillation had a 39% higher risk. That is not small. That is a sign you should take rhythm changes seriously. A 2019 study from Stanford University also showed why these flutters matter. In the Apple Heart study, only about 0.5% of participants got an irregular pulse alert, but when the watch caught an irregular pulse at the same moment as heart monitoring, it matched atrial fibrillation 84% of the time. And a 2024 UC San Francisco study estimated that atrial fibrillation may affect nearly 5% of the population, or about 10.5 million US adults. So yes, an odd heartbeat can be real, even when it comes and goes. What should you do? First, notice the setting. Were you resting in a chair, or had you just climbed stairs? Second, check your pulse if you know how. Is it steady or jumping around? Third, write down how long it lasts and what other symptoms show up with it. If you faint, nearly faint, feel chest pressure, or become short of breath, get emergency help right away. And here is the food angle. Do not pour gasoline on a rhythm problem. That means go easy on excess caffeine, alcohol, and heavily salted foods. Keep fluids steady. Eat regular meals. If your doctor says potassium is safe for you, foods like a medium banana with about 450 milligrams of potassium or a medium sweet potato with more than 500 milligrams can fit into a heart-friendly plan. The American Heart Association also recommends fish twice a week, with each serving around 3 ounces cooked. Now let's pump the brakes for a second. I'm not saying this to scare you, but I do want to keep this responsible. Not every chest pain is a heart attack. Not every skipped beat is dangerous. Not every swollen ankle means heart failure. Kidney disease, liver problems, vein issues, lung disease, anxiety, infections, certain medicines, and even dehydration can cause similar signs. And please be careful with self-treatment. Too much potassium can be harmful in older adults and people with kidney disease. Potassium supplements and some salt substitutes can be risky if you take certain blood pressure medicines or water pills. NSAIDs, which are common pain relievers like ibuprofen and naproxen, can also worsen heart failure symptoms by making the body hold on to sodium and fluid. Over-the-counter cold medicines and heartburn products can hide a lot of sodium too. So when should you see a doctor? Soon if you notice repeated chest pressure with activity, new shortness of breath, new swelling, odd fatigue, or frequent palpitations. Right away if symptoms are sudden, severe, or getting worse. Call emergency services if you have chest pain that lasts, severe shortness of breath, fainting, pain spreading to the arm, jaw, neck, or back, or a racing heartbeat with dizziness. So you're convinced but thinking, how do I actually do this? Start simple. Tomorrow morning, weigh yourself after the bathroom and before breakfast. Then look at your ankles that evening. Notice your breathing during one normal task, like taking out the trash or climbing stairs. If you feel palpitations, write down the time, how long they last, and what else you felt. Next, clean up the easiest food problem first. Check one label today. If a food is high in sodium, swap it for something closer to low sodium, which means 140 milligrams or less per serving. Build one easy plate this week with 3 ounces of fish, vegetables, and a medium sweet potato. If fish is too expensive, choose the budget-friendly option you can repeat. Simple beats perfect every time. Then give your heart the basics it loves. Aim for 150 minutes of moderate activity a week if your doctor says it is safe. Even 20 to 30 minutes on most days works. Try to sleep 7 to 9 hours. And do not wait until things are unbearable. Early action is cheaper, easier, and safer than late action. You do not need a perfect routine. You need a repeatable one. Look, there's a lot of noise out there, but your heart warning signs are often very basic. Pressure, breathlessness, swelling, fatigue, palpitations. You don't need to overthink this. You just need to stop ignoring what your body is telling you. Start with just one step today. Track your weight, your breathing, or your symptoms for the next 7 days. Your body will tell you if something is changing, if you are willing to listen. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong,